Hey there, I'm Dr. Jill Wener. I'm a certified conscious health meditation teacher and a tapping expert. And I'm going to, this is the first of a 7-part series on how to, for healthcare professionals, on how to manage the complicated emotions that come from being on the front lines of this coronavirus pandemic. And so obviously, taking care of patients and being a regular human being, it's just adding to the stress right now. We've got travel restrictions and plans changing and staying home and social distancing and all this stuff on top of the fear as a human of getting sick. But now adding to that is all these complicated emotions of being a healthcare professional and taking care of these patients, whether you're on the front lines or not. You're still a healthcare professional and you're still being called upon to go above and beyond what regular people have to do. And so I wanted to create this tapping sequence for you to help you with your stress during this time. It is obviously not a substitute for mental health care. So if you're feeling really, really, very depressed, having panic attacks, feeling suicidal or anything like that, this is probably not the right series for you. And I would encourage you to seek professional help, call suicide hotlines, any of those things, and reach out to your friends and family members and colleagues for help. So what we are going to do is I will, in this video, talk a little bit about what tapping is and what makes it so amazing and so powerful, and how we're going to use it throughout the series, so that for the rest of the videos we can kind of jump right in. I don't want you to have to listen to this explanation of tapping every single time, and you can just, because your time is very valuable. So what I'm going to do is talk about what tapping is, how to do it, why we use it in general. And then in the other videos, we're going to talk about different emotions. We'll talk about worry and fear and anxiety about health. We're going to talk about worry and fear and anxiety about logistics, so scheduling and job stuff. We're going to talk about anger and resentment. We'll talk about frustration. We're going to talk about guilt, and we're going to talk about sadness. So these are all some complicated emotions that can come up about coronavirus. The anxiety you may totally relate to. Maybe some of the other ones don't seem like you relate to them as much, but give them a chance, because I've surveyed hundreds of docs and I've gotten the sense that these are the complicated emotions. These are the most common ones that people are reporting. Because again, there's many, many layers to what's going on. There, you can feel some resentment about having to give up more of your life, putting yourself at higher risk. Even though you know that's what your calling is, it might still be hard that you're always the one that has to put yourself in that position. So tapping is also called the emotional freedom technique, or EFT. It is a stress reduction and healing modality that uses the same meridians or energy centers that are used in traditional Chinese medicine or acupuncture. But instead of using needles, we tap on those points. So there's points on the hand, on the head and face, which I'll get to, and a couple on the chest as well. So what we're doing when we're tapping is we're sending calming messages to the stress center of the brain, the hippocampus and the amygdala. We're sending calming messages to the brain while we are saying out loud things that are distressing. So if we have anxiety, we're going to be talking about all the reasons that we're having anxiety and the feelings of anxiety that we're having as we're tapping. So this isn't a positive mental attitude gets you through. This is really like getting in there with the negative feelings. So the only way that this process will work is if you say them out loud and allow yourself to feel them. And so what you'll do is I'll be doing it like a script. So I'll be saying it almost as if I'm you, as your proxy, and I'll say something as I'm tapping on one of the points, and then I'll pause as I'm tapping, and then you will repeat it. It's important to remember that you don't want to repeat anything that doesn't resonate with you. I am not here with you live. I do one-on-one tapping sessions if that's something you're interested in doing, but you don't have to have that in order for tapping to be effective. So I'm going to do my best from the research I've done and from my own experience as a physician. I practiced hospital medicine for 10 years during the swine flu epidemic, and taking care of obviously lots of very sick people. So from my experience and from the doctors that I've spoken to, what it is you might be feeling in this time, if something doesn't quite resonate, you'll just change it up a little bit to something that does resonate. And if there's a whole concept that, like the one on guilt, doesn't uh, resonate with you, just don't even watch that one. But you might want to give it a shot and start it, and then if it doesn't resonate, you can stop it. So the meridians that we're tapping on, so generally tapping can be used for so many things. It can be used for fear, like phobias, trauma, PTSD. It can be used for acute and chronic pain. It can be used to manage difficult emotions, to process problematic relationships. Let's say you're having an issue with a best friend or a spouse or your children. If you're facing a chronic illness, dealing with stress related to a chronic illness, dealing with stress related to anything. Your kids are leaving for college, behavioral issues with your kids, anything like that. So really, the sky's the limit with tapping. And you can also use it for positive things, to manifest things in your life that you want. And so maybe we'll do a bonus video at the end to help manifest some positive stuff in terms of this pandemic. So we're going to be using to manage complicated emotions due to the coronavirus and all the restrictions and social distancing and the higher level of stress that has been added to you as a healthcare professional. So we're going to start on what's called the tapping, the karate chop point. We're going to tap on each point about at least 5 to 7 times. So by the time we are finished with each statement, you're going to have many more than 5 to 7 times. So you don't have to worry about that or count that. So you're going to tap at least 5 to 7 times. You can use either hand. It doesn't matter. We're going to get to some points that are just one side of the face. So you can do both together. You wanted to, you could switch. I can't imagine you'd want to, but you can do it one hand on the, ipsilateral or contralateral, or whatever you want to do is fine. Whatever feels most comfortable to you. And I usually just do it on one side. So I do it with my right hand. I'm left-handed. I don't know why. My right hand just feels more comfortable. So this is called the karate chop point. See, this is where you tap here. It's the part of your hand that would like hit a wooden block if you were to try to break it. So we tap here, and then there's top of the head. So kind of in the middle here at the top, the inner corner of the eyebrow. So medial corner of the eyebrow, right where it meets the bridge of your nose, outer eye. And do this along with me so you can get a sense of what we're supposed to be doing. Under the eye, under the nose, chin, sternal notch, the clavicle point, the collarbone point. So you go to the sternal notch, you go down an inch and over an inch on either side, and that's where you're going to tap. So you can tap with your fingertips. I actually like to kind of cross over the midline here, and I use this part of my fist. It's just a bigger surface area. These points are very forgiving, but you can still, so I just like to use its bigger surface area. But you could just as easily do this, but then you have to think more about where you're going. So I do this, and then the last one is under the arm, where your bra line would be. So right here. And I like to use almost like I'm hitting a reflex hammer with my wrist. I like to do it like that. You can also use fingers. You can reach across like that. You can reach across like that. However you want to do it, it's just fine. And obviously, I will mention, you're seeing I'm touching my face. So if you are out and about in the world and unable to stay home, make sure you're washing your hands super well before and afterwards, because you're going to be doing, the whole thing is touching your face. So those are the tapping points. We start off with something called a setup statement. We repeat it 3 times, and I'm going to be saying it, but it's something to the tune of, even though I have anxiety that I'm going to be infected by this virus and unable to take care of my family, I love and accept myself. And then you'll repeat it. And then I'll say it again. Even though I have anxiety that I'm going to get infected with this coronavirus and not be able to take care of my family, I love and accept myself. You say it a 3rd time. Even though I'm have anxiety about getting this virus, and I won't be able to take care of my family, I love and accept myself completely. And I'll throw in some things that are different, because you're going to just be repeating after me, so you don't have to like invent these on your own. And then we go to the top of the head. I have anxiety, so much anxiety. And we'll go through the points like that. I'll be saying something and you'll be repeating it back. Once we're done with that setup statement, we put it to the side. Now, before you're tapping, you're going to want to make sure, we always want to do it based on an emotion. It's going to work much, much better if it's based on an emotion that you're feeling strongly. So, which is why anxiety is going to be the first 2. Anxiety, and there's kind of 2 different senses, because tapping on just plain anxiety is almost too broad. You want to narrow it down. So that's why I've narrowed it down into tapping about health, about your health, and versus anxiety about like what's going to happen in the system and in the world. So you want to be as specific as possible and feel that emotion, be feeling an emotion pretty strongly. And what you're going to do is you're going to get like a pain severity score. So anywhere between 0 and 10 is going to be how strong you're feeling that anxiety. So if it's a day you're feeling totally overwhelmed, you can keep all these emails, and there'll be links to the YouTube where they're going to be stored. You can you could go back to them at any time. So if you're not feeling particularly anxious on the day that you receive the anxiety email, no big deal. Come back to it when you do. And so, but I think it's helpful because we're all feeling some level of anxiety. If you do go through it, even if you aren't feeling wildly anxious, you can still do it, and then it will still work. And what it's doing as we're sending these calming signals to the brain, it's telling the brain that those things are no longer stressful and no longer distressing. And so it actually is often quite permanent and doesn't return. Now, if you're having anxiety, there might be 18 different causes of the anxiety. So you would theoretically want to tap through 18 different causes of the anxiety in order to expect all your anxiety to go away. And if that's the case, you may actually want to work one-on-one with somebody, not me or somebody else, because that's a very complicated issue and there's a lot to go on. But this can at least calm you down in the moment. It may come back, but you can always use this tool in the moment. So you're going to check your level before. So 0 to 10, maybe it's a 7, maybe it's an 8, maybe it's a 6. And then as we tap, I'm going to periodically stop. I'll pause. I'll have you take a deep breath in and out. And I'll ask you how strong, what's the severity level of your emotion. And you want to just like have a little piece of paper somewhere where you can jot down and follow that. Because once you get down to a certain level, you can do what's called tapping in the positive, which means once most of that negativity is out and you're feeling much more calm, you can do a positive statement, a sequence with positive statements that kind of reinforces the work that you've done. It's not necessary. I will tap you through that, but it's there for you in case that's something you feel like doing. And it feels really nice actually to do it. So we're going to follow the severity level. When we pause, it's also important to listen in as we're tapping, and when we pause, are you having any additional emotions coming up, new emotions coming up, or aha moments, or memories, or visions, or other images coming up in your mind? This is your subconscious telling you something. The tapping allows your subconscious to communicate with you a lot more clearly. You can hear that voice a lot more clearly. And so if you're all of a sudden remembering some event from childhood or whatever that comes up, that's important. Or if all of a sudden you're tapping on anxiety and all of a sudden anger comes over you, it's important to recognize that. And then you're going to want to tap on anger, because that's really what's underneath it. So it's like peeling back the layers of an onion. We get rid of the anxiety, and then there's other stuff underneath it that pops up that we can get rid of as well. How do you use this tapping technique in your life? You can do it once a day. For 10 minutes a day, you're going to tap on something. You can choose every day you can just go through this sequence of the 6 different videos, do one a day, and then start over again. If the anxiety is really bad for you, you can tap on anxiety for 6 days. You can just do it PRN. So whenever you feel anxious, you can pull up the video and tap on that. After a while, you'll get the hang of how to do a sequence, and you can keep it really simple when you do it on your own. I like to have a routine with it. I sort of do a little bit of tapping every day, but certainly when I'm upset about something is really a great time to do it. So you don't have to be wildly upset in order for it to work. But if you are very upset, that can increase its chance of being even more effective. So that's what we're going to be doing. The next video, which you'll get tomorrow, is about, as I said, worry and fear and anxiety about health, about you getting sick, about people you know or love getting sick. The next video is going to be worry and fear over the logistics, and anxiety over the logistics of all of this, and like the world going to hell in a handbasket. The next one will be anger and resentment. Following that, we'll do frustration, maybe about you haven't been heard, no one's listening, or people think you're crazy, and people, you see your friends and family members who aren't in medicine, or who are in medicine, not listening to the social distancing. The next one will be guilt, and the next one will be sadness, because we have also, again, lots of complicated emotions as healthcare professionals. So I'd love to hear from you. So you can just reply to the email uh, to see how this was for you. And I'm really excited to get started with you. And I look forward to seeing you in the next video. Have a wonderful evening. Stay safe, stay healthy. And remember, if you, this is not medical advice, this does not substitute for proper mental health care. So if you're feeling a little bit more affected by this than what some videos can do for you, please do reach out for help. And know that you are not alone. This is really, really challenging time. And the more we can all band together and be a community, the better. All right, I'll see you tomorrow.